Hello everyone, I hope you are doing well and you have watched last videos on our channel Medical Guruji regarding the 12-week antibiotic course for medical students. We are going towards the end of this course and this one is the 9th video of that 12-week course. So in the previous videos, from the history of antibiotics, it was discussed about the introduction and history, mechanism of action of antibiotics, spectrum of antibiotics, pharmacokinetic pharmacodynamics, adverse reactions and clinical uses all were discussed in details in the last videos. Please watch if you haven't not watched those videos. And this one is the 9th video in which we are going to deal about antibiotic use in specific population. So mainly we are going to focus on pediatric use of antibiotics, antibiotics in pregnancy, lactation, geriatric considerations and immunocompromised patients. So firstly go with the pediatric use of antibiotics. Common pediatric infections include acute otitis media, pharyngitis, community acquired pneumonia and UTI, urinary tract infection. So first one is acute otitis media. This one is the most common childhood infection for which antibiotics are prescribed. The decision to use antibiotics depend on the severity of symptom, age of the child and presence of middle ear effusion. So next one is about pharyngitis. Most cases of pharyngitis in the children are viral and which do not require antibiotics. However, bacterial causes of the pharyngitis, which when caused by group A streptococcus, may require antibiotics to prevent further complications. If we talk about community acquired pneumonia, antibiotics are used to treat bacterial community acquired pneumonia in children. And the choice of antibiotic depend upon the age of child, severity of illness and the pattern of local resistance. Last one is about UTI, urinary tract infection. These are common in children and often require antibiotics. The choice of antibiotic is guided by the susceptibility of the causative organism. Next we are going to talk about principles of pediatric antibiotic use. Appropriate indication. So antibiotics should only be prescribed when there is a clear bacterial infection, because if there is viral infection then no use of the antibiotics. Viral infections do not benefit from the antibiotics. Next, correct dose and duration. It is very important. According to the pediatric doses guidelines, age of the child, weight and which antibiotic is needed. It is important to follow established guidelines to ensure the effective treatment and minimize adverse side effects. Next one is about antibiotic stewardship. Promoting the responsible use of antibiotic in pediatric population, it is crucial to prevent the development of antibiotic resistance. This includes education, caregivers about the importance of completing the prescribed course of antibiotics. Course should not be left in between. So next, challenges which are faced in pediatric antibiotic use. First one is adverse effects. So children are more susceptible to certain antibiotic related adverse effects such as gastrointestinal disturbances, allergic reactions. We have to monitor for side effects. And next one is taste and formulation. Pediatric formulations of antibiotics should be palatable and easy to administer. Liquid formulations are often preferred for young children who cannot swallow pills. Compliance. Ensuring the children complete the full course of antibiotics can be challenging. Caregivers should be educated on the importance of adherence to the prescribed regimen so that the maximum desired effect can be achieved. Next one is about pediatric antibiotic guidelines. So guidelines says several organizations provide guidelines for the appropriate use of antibiotics in pediatric population. Standardization. These guidelines help standardize treatment and ensure the safe and effective use of antibiotics in the children's. American Academy of Pediatrics provides comprehensive guidelines for treating common pediatric infections. And WHO, World Health Organization, offer international standards for antibiotic use in children. So we have to follow the guidelines. As per the guidelines, we have to give antibiotics in the pediatric age group. Antibiotics in pregnancy. After pediatric group, now we talk about pregnancy. So firstly, we will talk about safety categories. The US Food and Drug Administration classify medications according to the including antibiotics into categories based on their safety during pregnancy. These were 5 classes. So one by one we are going to discuss about these 5 classes. First one is category A. It includes those drugs which show controlled studies and there is no risk in the studies found. After that, category B. Category B include those drugs which have no evidence of risk in humans, but animal studies show some risk, but human studies do not show risk. After that, category C. There is risk and benefit ratio is applied. Risk cannot be ruled out. Animal studies show risk, but no human studies are available. Category D. Positive evidence of risk. Benefit may outweigh risk in certain situations. Category D are those drugs in which if their benefit is more comparison to their risk, then only they are prescribed. And last one is category X, which are contraindicated in pregnancy. Their risk clearly outweigh any potential benefit. So these were the classes according to the US Food and Drug Administration. And it should be followed during antibiotics in pregnancy. Commonly used antibiotics during pregnancy. First one is safe antibiotics. So in penicillins, amoxicillin, cephalosporins, cephalexin, erythromycins, clindamycin. Antibiotics which should be avoided: tetracyclines, example doxycycline, fluoroquinolones, ciprofloxacin, sulfonamides, trimethoprim, sulfamethoxazole. Risk assessment. Untreated infections during pregnancy can pose significant risk, including preterm labor, low birth weight, and congenital infections. So, it is crucial to balance the benefit of antibiotic treatment against potential risk. Next, we talk about antibiotics in lactation. So, first one is which transfer to breast milk. Many antibiotics can pass into breast milk, but the extent of transfer and potential effect on the infant, it vary. So, according to this, antibiotics can be prescribed. Next one is influencing factors. Drug molecular weight, lipid solubility, and protein binding were the influencing factors. Next one is safe antibiotics. It includes penicillins, cephalosporins, macrolides, and aminoglycosides. Next one is use with caution. Tetracycline and fluoroquinolones due to potential adverse effect on the infant. It should be used with cautions. So next one is monitoring and management during lactation. Monitoring of infants. Watch for the sign of adverse effect. Observe for gastrointestinal disturbances like diarrhea or stomach upset can be there. Check for allergic reactions. Monitor for rashes or any other sign of allergy, and not change in feeding pattern. Observe the baby if there is change in eating habits. Clinical considerations for pregnancy and lactation. First one is individualized assessment. Each case should be assessed individually, considering the type of infection, the specific condition of antibiotic, and the health status of the mother and infant. Consultation with specialist. Healthcare provider may consult with obstetricians, pediatricians, and infectious disease specialists to make informed decision about antibiotic use during pregnancy and lactation. Evidence-based decision. These guidelines help healthcare providers make evidence-based decisions to ensure the safety and well-being of mother and child. And last one is guidelines and recommendations. Several organizations provide guidelines for the safe use of antibiotics during pregnancy and lactation, including the American College of Obstetricians and Gynecologists and the World Health Organization. So we have to follow the guidelines and consult to specialists if there is any change or any alterations to be needed. Geriatric considerations in antibiotic use. Pharmacokinetics and pharmacodynamic. The aging affect the body ability to absorb, distribute, metabolize, and excrete drugs. These changes can lead to altered drug levels and increased risk of toxicity or subtherapeutic effects. For example, decreased renal function in older adults may require dose adjustment for antibiotics that are primarily excreted by the kidneys. So it can be changed according to the age. Polypharmacy. Older adults often take on multiple medications for various chronic conditions. This increases the risk of drug interactions and adverse effects. Careful review of the patient medications list is essential to avoid potential interactions with antibiotics. Geriatric antibiotic challenges which are faced, so challenge and descriptions and the management strategy. First one is comorbidities, presence of other illnesses. The presence of multiple chronic conditions can complicate the management of infections in older adults. Management strategy for the comorbidities is consider such as diabetes, heart disease, COPD when selecting antibiotics. Next one is adverse effects. Older adults are more susceptible to antibiotic related adverse effects. Monitor for GI disturbances like Clostridium difficile infection and nephrotoxicity. Antimicrobial stewardship. Optimizing antibiotic use in older adults is crucial. Implement stewardship program to reduce resistance and improve outcomes. Next one is immunocompromised patients and increased susceptibility. So 3 to 5x higher risk is there in the immunocompromised individuals. Immunocompromised individuals are like patients of HIV, AIDS, those who are on chemotherapy like cancer patients, organ transplant, they are at higher risk, and risk is 3 to 5 times more as comparison to a normal individual or healthy individual. 48 hours critical treatment window. Prompt and appropriate antibiotic therapy is essential to prevent severe complications. And 30% atypical presentations. Infections in immunocompromised patients may present with atypical symptoms and making diagnosis challenging. So all these factors should be taken care if we are dealing with immunocompromised patients. Prophylactic antibiotics in immunocompromised patients. So in some cases, prophylactic antibiotics may be used to prevent infections in immunocompromised patients, and the choice of the prophylactic antibiotic depend on the patient's specific condition and the risk factor. This chart shows the drug interaction in immunocompromised patients like immunosuppressant, antifungals, antiviral, antibiotics and pain medications. Immunocompromised patients often take immunosuppressive medications which can interact with antibiotics. Careful consideration of potential drug interaction is necessary to avoid adverse effect and ensure effective treatment. Monitoring and management of immunocompromised patient. First one is initial assessment. Closely monitoring of immunocompromised patient during antibiotic therapy is essential to detect and manage adverse effects like drug interactions and treatment failures. It should be assessed initially. Regular follow-up. Schedule the frequent check-ins to assess the treatment response and if there is need in the therapy adjustment. Laboratory testings. Regular laboratory tests may be required to monitor drug levels, organ function and infection markers. Specialist consultations involve infectious disease, specialist oncologist, transplant physicians in complex cases. So these were the factors which are used in the management of immunocompromised patients. Initial assessment, regular follow-up, laboratory testings, special consultations. Infection control measures which should be followed are hand hygiene. Implementing strict infection control measures including hand hygiene is crucial to prevent the spread of infection in healthcare setting. Isolation protocols. Isolation of the patient with contagious infection help prevent transmission to vulnerable individuals. Environmental cleaning. Regular or thorough cleaning of the healthcare environment reduces the risk of transmission. Personal protective equipments (PPE). Appropriate use of PPE by healthcare workers and visitors protect both patient and healthcare staff. So these were the infection control measures. We should follow hand hygiene, isolation protocols, environmental cleaning and use of PPE. Optimizing antibiotic therapy for special populations. Pediatric patients. Consider age appropriate formulations, weight-based dosing and palatability of the medications. Pregnant and lactating women, balance maternal benefit against fetal or infant risk, and select antibiotics with established safety profiles. Geriatric patients, adjust doses for renal function, consider drug interaction and monitor closely for the adverse effects. And last one is immunocompromised patients. Provide prompt broad spectrum and initially assessment with narrowing of therapy based on culture results. Key takeaway: antibiotic use in the specific population. So pediatric use require careful consideration of age, weight, developmental factors. Appropriate formulations and taste are important for the compliance. Pregnancy and lactation, what should be taken care? Safety category guide antibiotic selection. Balance maternal benefit against potential risk to fetus or nursing infant. In geriatric, pharmacokinetic changes, polypharmacy, comorbidities and which affect antibiotic selection and dose in the older adults. Immunocompromised patients, higher infection risk, atypical presentations and potential drug interaction require specialized approach to antibiotic therapy. So these are the key takeaways which we should follow during the antibiotic use in pediatric population, pregnancy and lactation, geriatric population and immunocompromised patients. I hope this video will helpful for you regarding the use of antibiotics in the pediatric age group, pregnancy and lactation, geriatric and last one immunocompromised patients. Like the video. If you have any doubts, you can ask in comment section and stay tuned with Medical Guruji for the 10th upcoming video of 12-week antibiotic course for medical students. Thank you. Keep watching, share and subscribe.